Good evening or good afternoon, depending on where you're watching from. And welcome to this wonderful program we have here on blackdoctor.org. This is our monthly series. This is our monthly Seeing Eye to Eye series where we talk to some of the nation's top ophthalmologists and eye doctors and people in all about your vision health. And so we've done a number of these programs we do once a month. And so this one is going to be really unique. And I'm really looking forward to having this discussion tonight. So, as many of you know, here on Black Doctor, we celebrated Juneteenth just a couple of weeks ago, and so that is kind of universally known as the Black African American Independence Day in the nation. And next week, exactly 1 week from today, I believe, is July 4th, and that is the nation, our entire nation's Independence Day, and we all celebrate our nation's independence, July 4th, 1776. Now, what we also like to do, many Americans like to do, is set off fireworks in to commemorate the date and the occasion of our nation's independence. However, fireworks, as we all know, can be dangerous and are dangerous. And this is a weird, just kind of a startling stat I learned was that fireworks caused nine deaths and 11,500 injuries in 2021, according to the U.S. Consumer Product Safety Commission's most recent annual fireworks injury report. So, and here's kind of the no-brainer of it: most firework injuries happen between, drum roll, mid-June and mid-July, when we go and rush and pull all our fireworks out and pop them off. So what we have for you today is we have two wonderful ophthalmologists that are going to come here and kind of tell you, we're not going to scare you. We're just going to tell you what it is and give you some of the facts, and they're going to tell you what has happened. And we're going to tell you how to be safe, enjoy yourself, but how to be safe while doing it. So let me introduce the guests we have. But a couple of things I want you to do while we're bringing on our guests is, number one, I want you to let us know where you're watching from. We like to know where people are watching us from all over the world. So please drop that in the comment section. Number two, if you know somebody that needs this information, everybody knows that fireworks junkie that they have in their friend group, or they know that person. If you know somebody that needs this information, please tag them or share this on your page so they can get it and tag them when you share it on your page. Say, hey, look, you need to watch this. And then number three, if you have any questions about what is being discussed tonight, make sure you drop those in the comments as well. We like to, so we can get your questions asked and answered. We've got two very, very recognized, highly decorated, as I'm about to tell you, specialists here. So this is your opportunity to ask those questions that you always want to know. So do that tonight, drop those in the comments, and we will get as many asked as possible. So first off, we have Dr. Rachel Hooper. She is a plastic surgeon. All right. So she serves as a clinical assistant professor of surgery in the section of plastic and reconstructive surgery, Department of Surgery at the University of Michigan School of Medicine. So if y'all don't know, Michigan has a prestigious medical school. So that is a wonderful, wonderful position there. And then we also have Dr. Stephen McLeod. He is a cornea and refractive surgeon. So we got two surgeons on tonight. He is the chief executive officer of the American Academy of Ophthalmology and professor and chair emeritus in the Department of Ophthalmology at the University of California, San Francisco. So he is well educated. I'm talking Dartmouth, Johns Hopkins. You can see all of the great names on his bio. So we're going to skip all that because I know y'all are tired of hearing me talk, and we're going to get right to our guests. So welcome you both. We've got some people coming in from Chicago and Jacksonville, Florida, my hometown. They're watching us. So good evening to you both.
Good evening.
Good evening.
Okay, so I'm going to start with you, Dr. McLeod. All right, so fireworks are fun and entertaining. So we know that. I love them as kids. So how big of a problem are firework injuries?
Yeah, well, Alice, it's interesting that you started off with the stats that we get from the U.S. Consumer Product Safety Commission. But the problem is that that's going to be an underestimate. Those are the numbers that they're able to get based on the number of cases that actually show up and are documented in emergency rooms. So we know that that's a minimum. So yes, In 2021, ERs noted over 10,000 injuries, 11,500. And yes, there were 9 deaths associated with this, which were essentially injuries to the head, to the chest. So it can be a really significant issue. And as you point out, they really all get bundled into 75% of them actually between the end of June, beginning of July. So, you've mentioned the deaths, and so of course, many of these can be really, really serious injuries. And if it's not death, you can have, and you'll hear from Dr. Hooper about hand injuries that can be really serious. With the eye, we do know that in general, most of the injuries that we see can in fact be released from the emergency room to home. But about 15% of all of these injuries either need to be admitted to that ER's hospital or to go to another hospital. So, it's a high number, and within those injuries, there's a significant proportion that really are pretty serious.
Okay, so who is most at risk for these types of injuries?
Well, as you might imagine, it's young people who do crazy things. It's really children and young adults who are most greatly at risk. And if you look at the population statistics, it's really young adults between 20 and 24 years of age who are the highest estimated risk of ER-treated injuries. It's about 5 people per 100,000 of the population. However, if you look at the percentage of at the proportion of people with injuries, it's really the thing that's really concerning is about 30% of all of these injuries are going to be in children younger than 15 years of age. And within that age group, it turns out that if you look at age stratification, it's the group in the 5 to 9-year-old age group that are greatest at risk. And I think that one of the things to remember is that it's people who are bystanders who are oftentimes the injured. So you'll have younger people who may tend to handle the fireworks, but then you tend to have a relatively young group of people around there. And another reason for the high number of injuries in small kids is that people love sparklers, and they think sparklers are safe, and they give them to little children. And
Yes.
These things burn at 1,000 centigrade, and they can actually be really, really, really dangerous for little kids.
Okay, so we had to take a deep breath, and so it makes sense, right? So we got 5 to 9 because they're old enough to be excited. They're old enough, and they move around enough to where they know how to grab things and pick things up, but they don't know what they don't know. They don't really are able to ascertain the danger because that underdeveloped frontal lobe that they have at that age, and so they can't fully ascertain the danger, and so they just say, "Oh, that's looks great. It's sparkling." They grab it with their hand, and we have some problems. So that's why we have a hand specialist here, Dr. Hooper, to talk about this. So, how big of a problem are hand-related injuries when it comes to fireworks?
Oh, it's huge. We heard somewhere between 10 and 11,000 injuries per year. Roughly around a third of those are involving, the hand or upper extremity. So quite a significant percentage of the overall firework-related injuries to the body. So it's pretty significant. The age, group that's primarily affected, 20s, mid-20s. Males are obviously more commonly involved than females. And one of the articles that I reviewed, in preparation for this, cited about 7% of those patients are African American. So not an insignificant percentage being impacted.
Well, I think we had the most famous one recently was the football player.
Yep.
I don't remember. Yeah, I remember a few years ago. I think it was John Paul.
And the Giants. Yep, on the
Paul
Giants.
Pierre, and he lost a few fingers
Yep.
on his hand from playing with fireworks. And I happen to know one of his ex-teammates that lives here in the Atlanta area, and he loves fireworks, and they all did. And so, and even after that, he still sets off fireworks. So we understand the allure, but we also recognize, I think that really brought a lot of attention. That story brought a lot of attention to firework and firework safety. But as you know, once stories get old, we tend to forget about them from time to time.
Fortunately, he played defense, so he was able to continue, because as you can imagine, we'll discuss later on, hand injuries are, significantly impactful for young people in terms of their ability to work and do hobbies. And so, fortunately for him, he's still able to maintain his career as a NFL pro because of his position, but some people aren't as fortunate.
Absolutely. You're absolutely right about that. And so what types of hand injuries can result from fireworks?
Yeah, so there's a wide range. You can have anywhere from, a superficial burn that's kind of treated with dressing changes to a more significant burn that requires, removal of, burnt skin and surgery to reconstruct that area, ranging all the way up to amputations, as mentioned by John Paul Pierre. So, simple burns all the way up to amputations of fingers, parts of hand, and even parts of the upper extremity.
Wow. Okay. We keep saying that the 20 to 24, and I'm like, yeah, that's probably the group that's the most dangerous, because they've got this testosterone surge and there's this kind of hyper masculinity going on, and then they start becoming weapons. And I've seen the videos of them shooting, fireworks at each other and using them as weapons. And so, and then that's also kind of coincides with the time frame where alcohol use is legal. And so you start putting that combination, celebration, alcohol, fireworks. I'm sure that can be dangerous, not only just for the hands and eyes, but for other areas of the body as well. Oh my goodness. Okay. All right. So 20 somethings, get it together. So, Dr. McLeod, how often are the eyes involved, and what are some of the eye injuries that occur as a result of fireworks?
Yeah, so as Dr. Hooper points out, if you're going to pick a part of the body that's most likely to be injured, it's going to be the hands. But quite frequently you'll have the head and face region affected as well. So if you look at the head, eyes, ears, nose, that all together runs a little over a third of all of the cases of injury, and then it specifically eyes is just a little bit less than a half of that total of head, face, eyes, nose, ears. And so eye injury is actually a pretty significant proportion. The other thing that's worrisome about the eye injuries is there are a lot of disorders of the eye where you get one eye and the other one gets left alone. But with this sort of injury, anything that affects one eye is very likely to affect the other. So not only do you have what we call bilateral injury, in severe cases you now have bilateral either a temporary or permanently impaired vision, or bilateral loss of the eyes. And so that proportion of injuries, unfortunately, it typically is you have a high risk of it being both eyes. As I said, most of these cases are going to be ones where it's thermal injuries, where people are treated and can go and can be released to home. But as I've mentioned, they can be much more severe as well.
So if somebody does have an eye injury, what type of treatments are typically, and then what are some of the extreme things that had to happen because of the type of injury?
Yeah, so the treatment is going to depend on the nature and the severity of the injury. Okay. And as Dr. Hooper alluded to, you can sort of divide it up into two big categories. You tend to have one which is thermal injury, burns, and then the other which is going to be your explosive injuries. Okay. Now, for your thermal, and of course, what you do depends on how severe each of those is. So you start off with burns. Mild ocular surface burns are not a great thing, but if it's just very superficial, you have to think about, is it affecting the skin around the eyes and eyelid, or is it affecting the surface of the eye itself? In both cases, if it's relatively mild, then typically it's the surface area that is protective from infection that is mostly damaged, and so the treatment there is mostly to try to promote healing, to prevent infection from setting in, and to prevent scarring from setting in. More severe injuries are burn injuries are a totally different thing altogether, because you then have to get through the promoting healing, trying to prevent scarring, and in many cases having to deal with reconstruction. And you're dealing with, again, two different types of tissue. You've got the skin around the eye that you have to worry about. And particularly, as you can imagine, the skin for the eyelids is extremely difficult. It's extremely delicate. That can be difficult to manage in the case of burns, because you actually do need your eyelid skin to protect your eye. If you don't have the eye protected with the eyelid skin, then you run the risk of exposure, drying, the cornea melting, that sort of thing. So a lot of the techniques that plastic surgeons will use for other parts of the body in dealing with skin burns, we have to do around the eye as well. But then we have the additional challenge of, what do you do if the surface of the eye globe itself is thermally injured? And that's another really complex set of that's actually my area of expertise is cornea external disease, and that really is a real challenge that can include even things like cornea transplant and so on. On the explosive injuries, again, the problem with explosive injuries is that if you do have a rupture to the globe, it's one thing to have a rupture to your eye if it's a sharp penetrating injury. Oftentimes, if it's clean, you can close it, you get your foreign body out. You hope that things won't be too disrupted. However, with the kind of explosive injuries you see with fireworks, you tend to have a lot of disorganization of the globe. Those can be very difficult to repair, and we will do our best to, suture, deal with the skin, deal with the globe, probably take out the cataract and so on. But those can be extremely difficult to recover eyesight if there's just too much disorganization of the eye. That's probably a little bit too scary for our audience, but this is sobering stuff.
Sobering. That's the best word. It's just understanding. And then I think, I would add that as you're talking about the primary groups that are impacted, there are people that typically have a long life ahead of them. So you want to try to preserve their vision as much as possible, especially if you're dealing with young children. You want them to have that vision throughout their schooling. 20-somethings, even though that could be a little bit reckless, you want them to have, it's like, okay, not something that's going to be a permanent injury. They have to remind themselves that they got a little too crazy with some fireworks one year. So it's definitely, that feels like more of a compounding factor to your work, because if you're dealing with the 6-year-old, that eyelid is even smaller and more delicate at that point in time. So
yeah, and I just want to get back to that one point, that again, the reason these can be so devastating is because if you've got a bad injury to one eye, it's highly likely that the other eye is going to be involved as well. That's the really tough part here, because that's real disability for people.
Yeah. So Dr. Hooper, all right, so we've got the treatments for the eyes. What are the treatments for the hands?
Yeah, similarly, dividing the injuries into kind of the burn and the explosion, I would say from a burn perspective, depending on the depth of the skin injury, anywhere from dressing changes to actually having to excise the burned skin, like down to tendons. And then resurfacing that area, which may involve taking skin from the thigh or the back or the upper arm to resurface that area. Sometimes I've had to temporarily sew patients' arms to their groin, to their abdomen temporarily to provide, coverage for areas that have been burned in the hand. As it pertains depends to, the explosive component, again, a wide range. If the digit's amputated, in general, it's usually we're not able to replant those because there's the burn and blast component. And when we're repairing blood vessels, those are just not suitable to reconstruct. When we're talking about, fractures, again, if the bone is kind of exploded and there's very little of it left, there's very little to reconstruct with our usual mechanisms. So it just kind of depends on what remains, how much damage has been done, and kind of, what you're able to work with. I would say in general, the reconstructive options are very, very slim and challenging if it's on the blast component of the spectrum.
Okay. All right. So what? So they have the surgery, and you can have your arm sewed to your side. All right. I'm just getting the visual on that one. So what happens after? What is that recovery like for a?
Yeah. So let's take the extreme case where we have to sew the arm to the groin or the belly. In general, they're attached for about 3 weeks to
Okay.
allow the blood flow to come to that area before we can detach them. And then they go through months of occupational therapy to regain whatever function they can with what they have left. And so it's challenging for the patients who have lost fingers or parts of hands. Once the wounds have been healed, there are prosthetics available to help patients, maximize what they have depending on what joint remains. There are different level prosthetics. But the recovery you're never the same. Obviously, even we do our best efforts to reconstruct what's left. And, even with advances in prosthetics, you're never the same.
Yeah, it kind of feels like they need like a psychiatric consult after that as well. To go kind of get through that mental aspect. There may be some trauma associated with that, and then there is the loss that comes from whether
Absolutely.
it's the loss of a digit or functioning, whether it's vision or your hand functioning or some other part of your body functioning. So that there's a lot that you have to process in that space. So I'm sure that there needs some sort of counseling after that, with that occupational therapy.
Oh yeah, it's in the 20 to 30 something that, previously healthy, no, chronic, high blood pressure, diabetes. These are young, healthy people. It's life altering
Yeah.
to have these injuries and the hospitalizations and the multiple surgeries and the ongoing therapy that's required to try to restore some semblance of normalcy, which is unfortunately not going to happen. Yeah.
Yeah. Yeah. So what's your recommendation? So we've talked about a lot of bad stuff, guys. So stay with us. We're going to get to what you can do. So Dr. Hooper, help our audience understand what are some of the things that they can do to reduce hand injuries when it comes to handling fireworks.
Well, first and foremost, I'd recommend people don't handle fireworks. As much as you can, enjoy all the professionally coordinated fireworks shows that occur in almost every city or on TV. You know, my recommendation would be not to handle fireworks. I can't say otherwise.
Well, I mean, that's a recommendation. Just, look, go to your local park. The city does a nice firework display. Get your blanket, get your chair, watch the professionals shoot them off, and that should be it. If you're close enough, you live close enough, you can go out on the roof of your apartment or your home, whatever, and watch them from a safe distance. But that's it. So Dr. McLeod, I'm assuming you're going to say something very similar with regards to reduction of injuries.
Yes. So, and I'll start off by just, reminding people that, the reason that it's really so important for us to do everything we can to reduce risk is that, remember that we're not just, reducing risk for ourselves, we're actually reducing risk for bystanders. And even if you think of something, the cases of deaths that occurred in 2021, one of them was a bystander who was hit in the chest by a mortar style firework that basically fell over and was off path. So at the American Academy of Ophthalmology, we really do really adhere to what Dr. Hooper has suggested. We really recommend that individuals avoid commercial fireworks for home use, and really always go with professional public fireworks shows. And just to put it in perspective, if you look at all of the injuries that were reported in terms of ER visits for 2021, as far as I could tell, looking at the report, there was not a single one that was associated with a public professional fireworks show. It's all I'm handling this by by myself. But when you do go to the professional shows, it's important, just to also have common sense there as well. There are safety barriers. Make sure you respect them. Stay away from there. There is the possibility of unexploded fireworks around, so stay away from anything that looks unexploded. And in those cases, you definitely want to make sure that a police fire department is made aware that that's sitting there. We do recognize that public events may not be an option for everyone who lives everywhere. If you're not in an urban area, if you're not in an area that has a local show. And there are jurisdictions where it is legal to purchase and use consumer fireworks. So we recognize that can happen. And so there is some common sense that we would recommend that people respect in that regard. As we talked about a little bit earlier, children are indeed at high risk. Most of them, again, injured as observers. Children have to be supervised. They should not be allowed to play with fireworks. And again, we're really not enthusiastic about sparklers. For the heat risk that they have. We really feel we're big believers at the Academy in eye protection. And so the operator, any close bystanders should indeed be wearing eye protection. Just again, common sense stuff. If you're working with fireworks, you want to be in an open area. You want people standing back. We live in a fire area here in California. You really don't want any flammable materials like dry leaves, grass, or anything like that around. And you really also want to make sure that if there's anything that any risk, there is a risk of combustion, so make sure you always have a supply of water nearby, particularly and certainly buckets of water nearby. That some people would recommend that you pour on duds that don't explode. We also worry a lot about explosions in containers that could then just explode glass fragments and so on. That could be really dangerous, glass and metal fragments and so on. So never light your fireworks inside any sort of container, especially metal or glass. And some of the death injuries that have been reported, people actually manage to get themselves over their firework when they're setting it off. Do not, go over the firework as you're setting it off. You never want to go back to go and check if something, and look at it to see if it's why it hasn't gone off, if things seem a little slow. A lot of this is really common sense stuff. And not getting carried away with the excitement of the moment. But again, if at all possible, public shows, professionals at a distance, because and fireworks always look the best off in the distance anyway. You got to give yourself some space.
They do. So are you suggesting that we wear any protective eyewear, like something that we would wear if we were playing sports, like the sports goggles, or something similar to protect our eyes if we decide to engage in home firework use?
Yeah, standard construction grade safety glasses. Same thing that you would have on a construction site.
So 20 somethings, it's okay. I know your friends might make fun of you, but it's your eyes, not theirs. So, so
Stylish.
that's right. I'm sure one of the high-end glass makers could probably come up with a firework safety one, or you can put on the ski goggles.
There you go.
Those might be fashionable. You never know. Give it a shot.
So everyone gets to look like Kareem.
I love those. So, parent, anybody, not just anybody, I'm putting in the comments some links for my friends at the NIH, and there are multiple links about eye safety for kids. There's about sports, protective eyewear, all these things that we're talking about. I'm putting some resources there for you to click on and share there in the comments. So please make sure you take advantage of those things, because you got a week. To figure it out. So, Dr. Hooper, how can we avoid injuries on the hands? Should we wear gloves? Should we be using a longer kind of wick to light the fire? What can we be doing to stop the hand injuries?
I've already shared my opinions on enjoying the professionals, but if you're doing it yourself, certainly if you've ignited a firework, don't pick it up with your hands, even if you're checking it to see if why it hasn't performed the way that you think it should have performed, because that may be the time that it performs when you have it in your hand. So avoid picking things up with your bare hands, obviously. And as Dr. McLeod alluded to, having a bucket of water, close by to really kind of put down whatever flammables around is helpful. But there are no specific gloves. You might be a little less dexterous if you use gloves with lighting it, and maybe more apt to cause more trouble.
Right.
I'm not aware of any lengthy, lighter that will get you far enough. But, just if you're going to do it, read the instructions and avoid picking things up with your direct hands. Don't light anything in your hand, obviously. As Dr. McLeod said, there's some common sense things.
Yes. But as we know, common sense is not always common. So that's why we're having these programs, to help people understand what they can and should be doing. It just really, I was, as a kid, I was just like going to the shows. I didn't like, and we would have the fireworks, and then, but again, I also remember doing silly stuff like throwing firecrackers at each other, lighting them and then throwing them at each other, or that sparkler. So Dr. McLeod, you mentioned before we even got on the air about the temperature of those sparklers, and we tend to light them and then hand them to small children because we say, hey, this is safe for you to hold and have some fun with fireworks. Kind of give people some understanding on like how hot those sparklers can be, and what could potentially happen if one of those sparks that are jumping off hits them in the eye.
Yeah, so they'll get up to estimated, 2,000 degrees in temperature, and so the type of injury that you can get, certainly for the eye at that temperature, if it gets in range, really can be devastating to the eye, to the eyelids, devastating to the cornea. Typically, fortunately, if people get a little bit too close, they'll actually start to feel it. So it turns out that in terms of the numbers that we see that actually lead to severe corneal injury, thank goodness it's not a majority of cases, but there's a minority where it can be really, really severe. And so I think the main point that we want to make is that is just the fact that people tend to think of them as sort of the safest thing possible because they're not explosive and you can just sort of run around with them. But they're I'm in that camp that two things should be banned in life: coffee tables and sparklers.
What happened? What's wrong with coffee tables?
Oh, you have no idea how many pediatric eye injuries occur with, that benign-looking coffee table.
All right. As a parent, I'm thinking more like toe injuries from walking around in a dark house and that coffee table. Since I swear that it's allegedly an inanimate object, but I swear they jump in front of your little toe at the most inopportune time. But that makes sense. The kids running around the houses and those corners on the coffee tables. Oh goodness! All right. So I was a good parent. My kids still have all of their limbs and fingers. And
you just have to realize ophthalmologists are paranoid. Everything looks as if it's trying to, injure your eye. So,
Okay. All right. So we got to keep our hands away. So Dr. Hooper's on the record saying, don't do it. Like, that's her advice. If you're going to ask her for her advice, she's like, don't do it at home. Go to the conference show. Dr. McLeod, it was more measured. He said, hey, look, if you're going to do it, safety goggles, have it in a well open area, and have a bucket of water, fresh water there, just in case something does ignite. If it doesn't explode like you expected it to, don't pick it up trying to shake it or make it, because it still can. Remember, a lot of those fireworks and things are just wrapped paper really, really tight. And then they put that gunpowder, whatever explosive inside it. And so if it doesn't ignite, it might ignite at that point in time if you shake it, and now it's in your hand. And unfortunately, I've seen that. Thankfully, there wasn't a hand injury, but again, it was my younger cousin. He might be watching, but we were setting off some fireworks, and he wanted to set one off. He was a little kid. He was 4 or 5. And he grabbed one, but as he grabbed it off, they're in the packs where they're all woven together. He snatched part of the wick off. So when he went to go light it, it didn't have a long burn. So it went pow. And luckily he had just let it go as soon as it went off. But it scared him enough to where he's now blames me for his fear of fireworks. I'm okay with that. So. All right, as we're wrapping up here, if there's any questions, again, I'm putting the resources in the comments. But if you have any questions, your viewers, please drop those in now as we're getting close to the end of this broadcast. So any final thoughts that you'd like to leave with our audience as I'm putting the resources in here about fireworks safety? So Dr. Hooper, we'll start with you.
Hand-related injuries from fireworks are very devastating when they're in the severe explosive range. And I can't emphasize enough, to enjoy the professionally coordinated fireworks shows, and just think about, the life that you have to live, and you want to maximize your hand function for that period of time, and it's not worth it to risk that with fireworks.
Amen to that one. All right, and Dr. McLeod.
Okay, so I'm going to assume that everybody who's listening to this now knows that they're not going to handle the fireworks themselves. So this is directed to the innocent bystander who is, who's affected by a firework. So the question is, what do you do if you actually are injured? And I think again, we talked about the fact that you can have a range of injury. And I think that it's pretty obvious. If it's a severe injury, everyone knows, go straight to the emergency room, seek medical attention immediately. There may be the question, okay, should you rinse the eye out, whether it's a thermal or explosive injury? Generally, we say no. You really just want to leave things alone. You don't want to rinse the eyes out. You don't want to try to remove any objects you think are stuck in the eye. You don't want to apply any medication or salves or ointments or take any pain medications. The reason for the pain medication that we tell people to try to avoid is that it might affect bleeding time during repair. Just so people know, there is a time for irrigating out the eye. That's for when you have a chemical injury to the eye. That's not what we're talking about here. Here, if we're talking about an explosive injury, thermal injury, fireworks injury, you really don't want any irrigation. You don't want anything on the eye. You want to go straight to the emergency room. Now, you could have injuries where things seem a lot more mild. And the problem is that, in explosive injuries, sometimes you can have small degrees of shrapnel that don't look as if they've done a lot of injury, but actually can be really problematic. So if there is some sort of fireworks misadventure and you believe that the eye has been involved, even if it doesn't seem as bad as you might think, it's still important to actually seek medical attention because, if in the scenario where you've got the potential for a high velocity small fragment injury, you do want to make sure that it's checked out very, very carefully. Those would be my parting thoughts.
All right. So that was great information there. With regards to how to stay safe, and there's a whole bunch of reactions, or like the wow reaction that you have on Facebook about what's going on. Yeah, it's serious. And so the last resource I'm going to put in there for my friends at Prevent Blindness is a firework safety. This is a firework injury safety quiz. So I put a number of resources in the comments. First aid, protective wear. There's an infographic from the American Academy of Ophthalmology. There's a video, right? So some of us that don't like to read anymore, there is a video in there that you can watch about fireworks. Also, there again, like there's a safety quiz that you can kind of quiz yourself on making sure that you're doing all the right things. And then there's some more facts about firework injury. So hopefully, again, as I said at the top of this program, this is not designed to scare you. This is designed to give you the facts about what is going on with fireworks and the injuries. I'm going to reiterate, there were the latest data from 2021, 9 deaths and 11,500 injuries. And those were the ones that were reported. So as Dr. McLeod kind of alluded to, he didn't say it, but I will say it. Y'all know, like y'all try to not go to the doctor and try to repair some of these things at home, but that damage could be more than what you see on the surface. And so while, yes, you might have to put something on your insurance. Yes, you may have a high deductible. Yes, but there is no replacement if there is permanent damage to your vision or to your hands. And many of us, most of us, need either our eyes and or our hands in order to be able to work effectively. And so that could cause a significant alteration of your life in terms of what you can and cannot do. And so we want you to have fun, enjoy yourself on the 4th. We're all going to be celebrating. We're going to celebrate responsibly. So I said it before we got on air, and I'm going to say it now. Alcohol and fireworks do not mix. Okay, that's not a chaser for fireworks. Alcohol. So whatever, if you're going to celebrate with alcohol, just go to watch the professionals do it. If you're going to light your own, wait till after you're done with the fireworks before you start partaking, adults only, in any type of alcoholic beverage. Just the baseline safety for you and your family. We want you to enjoy, but we want you to wake up on July 5th without having an injury or some damage to your eyes or to your hands. And so I want to thank all of our partners at the Children Vision Equity Alliance, Prevent Blindness, the National Eye Institute, as well as the NIH, I want to thank the University of Michigan for letting us borrow Dr. Hooper, and the University of California at San Francisco for letting us borrow Dr. McLeod. Thank you so much for coming and giving us this, pun intended, eye-opening talk about fireworks. So as the title of this program is, I'm going to end with that. Fireworks, be careful. And we'll see you next time. Thank you for watching.